get the benefit of my music taste because it's not set up for music, but you would have been listening to the Black Eyed Peas right now if it had worked out. So, I know, sorry about that. So, spot on time, which is very unusual for me. We are starting our first clinical psychology club of the semester. So welcome, I'm Lou Shirley. I'm a clinical psychologist, I'm a clinical senior lecturer here. I'm also the Director of Education for the division, which sounds very grand, but I only started it on Monday, and it's quite frightening, so I'll let you know how that one goes. I'm really pleased to see you, but also slightly daunted, because I thought maybe 5 people would have read the email. But it's good to see so many people here. And today is just going to be an introduction into clinical psychology. But it'd be good for me to know, all right, okay, so the agenda is going to be to start off with, you're all going to talk to each other, which is annoying, but you're going to have to do it if you get into clinical psychology, so you might as well start now. And you're going to be talking to each other about what you need to be a clinical psychologist. Sorry, I'm going to be talking to you about what you need to be a clinical psychologist, what kind of experience you need, what the role involves, what academic qualifications you need. I'll give you a brief description of what a UK-based clinical psychologist does. So I don't really know about clinical psychologists in other countries. I know a little bit about international students' ability to apply for our UK degrees, which I can talk about later. And then I can talk you through the Blackboard resources. Just to let you know, the session is being recorded. I just thought I'd let you know, because it's obviously an extracurricular session. But we're recording it for the benefit of people that can't make it because of other commitments on a Wednesday. All the clubs will be on a Wednesday because it's the easiest time to get you all together to manage all of the year groups because you don't have teaching. But apologies to people who are listening to this later. I can't work around clubs and things, otherwise I just couldn't manage to put the club in. So if you could get your phones out, go onto the QR code, have a look at Mentimeter and answer some of the questions that are up there on Mentimeter. I'm a bit clunky with Mentimeter, so I'm just going to nip onto it there and just make sure that it's hang on. I actually need to start it, don't I? Oh no, you're doing it, that's fine. Multiple choice, why can't I do anything with this? There we go, Mentimeter, where's it gone? Back to where it was. You haven't missed anything. Alright, so if the newcomers could just take a moment to click on the QR code. Okay, so you should now be able to also go on to the next question, I think, on your phones. Is it working? Yeah. Right, thank you for that. Right. So the first thing that you're going to do is you're going to talk to each other. You might be sitting with people you know, you might not be sitting with people you know. But if you could just have a brief description about what it is that you want from this club. What do you want to know today? What is it? What's the burning question? And that's going to be helpful because later on I'm going to ask you what your questions are, and then you and your partner or you and your group will have an idea of what your questions are already. So just have a quick chat with each other just for a couple of minutes. What do you want from a club like this? What is it? What is a clinical psychology club? What does it mean for you to come here? What is it you want? Now you've had a chance to chat with each other and think about what your questions are, pop them up there and I'll make sure they're answered by the end of the session. Okay? Just to let you know, I'll be leaving at about 10 to 6 tonight. If you want to catch me and I haven't answered your questions, you'll have to walk with me to the Piccadilly station. That's fine. Okay, so about 10 to 6 we'll finish it, not before. Right, thank you. They're really good questions. If I don't manage to answer all of those questions today, they will be answered during the course of the Clinical Psychology Club sessions. There's some seats at the front. So there are going to be 3 clinical psychology clubs per semester. They're totally voluntary. They're voluntary for me as well, but I'll be here. So they're totally voluntary. Come if you want to. I'll be advertising in plenty of time, and look out for the SHS Hub emails, or I'll try and send information to your academic advisors as well, so they might, nod you the wink if you haven't picked it up. And there's also, if you go in your Blackboard space, in your BSc Psychology, have we got any Cogneuro students in just before? Right, okay. I try and get information out to you as well. It's not as slick because I don't have access to your Blackboard space. But keep an eye out for the emails, and I'll let your course director know as well, so hopefully we'll find out, okay. But for BSc Psychology students, if you go into your Blackboard, into BSc Psychology, there is a full folder for the Clinical Psychology Club, and I'll be updating that over the next week or so with all the different dates and the different things that will be happening during the club. I don't know all of the things that are happening in all of the clubs yet, but I have got the next two ready, so I can talk to you about what they are. Okay, so the questions are great, and don't worry about asking me questions while I'm going along as well, so just stick your hand up. I'm quite short-sighted and very vain, so you have to put your hand really high for me to catch sight of it, okay? Right, so I'll start off with what you need to be a clinical psychologist. Shall I just tell you what a clinical psychologist is first? So, a clinical psychologist is a mental health professional who is trained to work in a number of different ways to provide therapy to clients to help them with mental health problems, but they also have a lot of different arrows to their bow, so it's not just being a therapist. They also provide supervision and management to people, they provide leadership, they develop services, and they are part of designing new interventions for people. They will also do interventions at a staff level, so they might use the same models that they use with individual clients to work with groups of staff or individual staff to help them understand perhaps a situational problem, and they might supervise their multidisciplinary colleagues. They can either work individually or as members of teams. You can work independently as a clinical psychologist, or most clinical psychologists probably are employed by the NHS in England, but there is a growth in independent working in clinical psychology. Okay, so to become a clinical psychologist, you have to graduate from a BPS accredited university, so well done. This will be your first step. Your undergraduate degree will be the first tick in the box to going on to study clinical psychology. You need to graduate with at least a 2-1, or you can get a 2-2 if you then provide evidence of your ability to go on to doctoral level study, because it's a bit hard work, the doctorate. It's not for the faint-hearted academically. So it might be that if you don't feel that you're someone who wants to continue their academic career, another career in mental health or therapy might suit you better. And we'll talk about that in the club as well as we go along. So although it's called the Clinical Psychology Club, over the last few years it's kind of grown a little bit to encompass other different professions and other different ways of doing therapy with clients. So the reason that you need to graduate with a 2-1 is just because there's a lot of academic work. So in the doctorate, which I'll talk about later, there is another thesis to write. So you write a doctoral level thesis, which is above a master's. So you can see why you need to be able to demonstrate that you've got that research skill, that ability to understand and use knowledge. For most clinical psychology doctoral degrees, you must have experience of working in a relevant setting, but the extent and the nature of that experience differs between courses. So at Manchester, you have to demonstrate 12 months of full-time work in a clinical setting, an appropriate clinical setting. That's not necessarily working under a clinical psychologist, but that is definitely the easiest way of proving it. Hi.
Hi, I was wondering if we do a placement year between our second and third year, would that count as that year's experience if we have like a placement within mental health?
Okay, that's a really good question. So there's a question at the front, I'll just repeat it in case people can't hear. There's a question at the front about whether if you do a third year, like a year out placement, so between second year and your actual third year, whether if you do that in a mental health setting, that might count towards your experience. That'll very much depend on the course. For Manchester, not unless it was paid, and it's difficult to get clinical psychology internships paid at that level. There might be other universities that accept that as part of their, but there are other good reasons to do that kind of placement, which we can talk about. So I will be bringing placement students in to talk to you, who I'm hoping that a couple of my previous third years will be coming back in to talk to you about their work placement, one of whom has actually just successfully got an assistant psychologist post straight from undergrad, so we want to pick her brains. Yes, so there are some courses. So for example, there's a course, the Lancaster course. You don't have to have any relevant work experience, but they have a very stringent online assessment that you have to pass before you get to interview. I think it might be something to do with research methods, and I think it might be a statistical thing. So I wouldn't have got in, because statistics and me, we don't really get on very well. So you choose, if you're going for clinical training, you would choose your course depending on what their criteria were. If you have a choice, now I was living and had children when I did my doctorate, so I had no choice about where I applied to. There were like 2 local universities. So if you're lucky, then you can choose your university, but if not, you just have to make sure that the university's close to you, you've got the relevant experience for those universities. Right, and then you have to apply and be accepted onto the doctorate in clinical psychology. I'm guessing you might have heard, anyone that has come to the club before or spoken to people that are wanting to do this, this career course, you will have heard that it's very competitive. So actually applying to get onto the doctorate is a big thing. Unfortunately, most parts of this process are pretty competitive, so to get some of the jobs to make yourself look like a good candidate for the doctorate is also quite competitive. But don't let that put you off, because even though it's competitive, somebody has to get on, you know. It doesn't mean it won't be you just because it's competitive. So I wouldn't let that discourage you, unless what you don't want to do is spend, because it does take a number of years to build up the experience usually for courses. What was your question?
Yes, like speaking of doctorate degrees, like what would be the pros and cons for applying for a PhD degree and a PsyD degree for becoming a clinical psychologist?
Yeah, okay, so in the UK, you can't become a practicing clinical psychologist with a PhD, because that's a research degree. The doctorate in clinical psychology, and I'll come on to exactly what that involves, is a professional qualification, whereas a PhD is an academic qualification. So it doesn't prepare you to work therapeutically with people, it prepares you to do research. So if you want to work as a clinical psychologist in the UK, you have to have a doctorate in clinical psychology. So you can't do it through a PhD route. Although I have a PhD as well, and that helped me get onto the doctorate in clinical psychology. So there are good reasons for doing a PhD, but to be a practicing clinical psychologist actually doesn't help.
It's like the degree for clinical psychology is quite unique, like quite a unique one. So it's like we also got like psychology doctorate degree.
So I don't know how it works in other countries, but I think we are going to get Anna Hood, who is a clinical psychologist who is registered as a psychologist in this country, who actually trained in the States, and she might be able to tell us a little bit more about her training. I think that there was more of an academic route to that, but then they've got different kind of practice elements. So for a PhD in psychology, in clinical psychology, you don't have a placement, for example, so you don't work therapeutically with people. You might do research with the clinical population, but you're not learning how to do therapy. Whereas the doctorate in clinical psychology, you learn research, therapy, and you get clinical knowledge. Is that all right? Yeah. It might become clearer as the year wears on.
Because like there's another sort of degrees like in the United States and Hong Kong.
Right. Okay.
Yeah, and that's quite confusing.
Yeah. Can you tell me about Hong Kong sometime?
Yes, like.
Yeah, that would be really good. Yeah. Sorry.
You mentioned that one of the undergraduate students got an assistant psychologist role. Can you not like progress from that role, or would you still have to do like your doctorate?
Still got to do the doctorate. Yeah. So the question was, if you get an assistant psychologist role, can you progress from that role into being a clinical psychologist? Unfortunately not. You have to have that 3-year training in the UK. So it gives you really good CV, and it allows the doctorate to see that you're ready to take that step to education in the clinical psychology sector, but it doesn't allow you to do that. Hi.
Do you need a master's first? Like, do you need a master's?
Okay, so the question, I'm also a little bit deaf, I'm sorry, I'm hopeless. I'm clearly getting quite a lot older, day by day. The question was, do you need a master's to do the doctorate? And the answer is no. It can help because it shows the people that are reading your application form that you've done more research, so you've moved up a level in your research, you've got more autonomy, you understand more about research methods, you gain more knowledge in the area, potentially, but actually you can also do that in the field. So it's not essential, no, it's definitely not a prerequisite. Some people find it helpful to get their assistant psychology posts. Other people haven't found it helpful at all. So it's very expensive, it's a very expensive part of the pathway. I should be advertised. We obviously run a master's degree, master's program in clinical and health psychology, and it has, I believe, helped some of our students to progress. but it doesn't get you into the doctorate, and you don't have to have it. All right, so far? Yeah? Okay. Oh yes, and then you complete that 3-year. So it's a 3-year doctorate course. So what kind of experience are you expected to accrue before you make these applications? So there's lots of different sorts of experience, and what I'd say is start think about it as a set of shallow steps towards your goal. You're probably not going to, if you've done no work with people ever in your whole life, you're probably not going to be able to walk straight into an assistant psychologist post. You won't be able to until you graduate anyway, so you've got to find something during your degree that's going to help you to then do your assistant psychologist post if that's what you decide to do. But what you can do is you can build up your experience right from the beginning of your university career by just basically working with people or being with people in some way or another. So that might be volunteering, it might be doing things like doing helplines for the university, or being a mentor for other students or something like that.
Sorry, you said the assistant psychologist job, that's after graduation. Is it unheard of to do it as a placement year? Are they too young?
Okay, so the question was, can you do an assistant psychologist post as a placement year? They might be advertised as an honorary assistant psychologist post, but you won't get paid.
Okay.
And my experience of talking to students that have done that is they get a lot out of it, but they also miss experiences that you would get as an assistant psychologist because of the level of supervision you can have and the level of autonomy you can have because you're not a paid member of staff. So you're not employed by the NHS, so they can't let you do too much. So you're doing a lot of observing, a lot of data entry, but you do get to know more about the profession.
So it's not necessarily like the job that you really want if you want to be a clinical psychologist.
As a work placement year?
Yeah, like should you be gunning for it or like at any other position?
I'll ask my students to talk to you about that because there's so one of the students who I'm hoping will speak to you and it'll probably be online is Rachel Dickinson, who did a research internship with me in the summer of her second year, and Rachel went on to be a psychological wellbeing practitioner. So we'll talk about that a little bit later. Rachel did do an honorary assistant post for her year out, and she can talk about the pros and cons of that because she got a lot from it. But on the other hand, she didn't think it didn't quite give her what she needed to walk into an assistant post afterwards. Yeah, so there's her, and then there are a couple of other students who have done work placements, sometimes not related at all to clinical psychology. But remember that your generalist skills are really important as well. And one of the things that we'll be doing in these sessions is, they aren't usually this crowded, by the way. People usually lose interest after the second one, so do keep coming back. But one of the other things that we do in here is think about CV building. So think about exactly what sort of experience you want to be building. But more importantly, how you describe that experience to a potential employer. Because if you were to say, if you were to talk about your peer mentoring, so this is something that you do in second year for first year students. Have we got second years in? I think we've got, yeah? Are you peer mentoring? Yeah, okay. So you might describe it as, you might just say I'm peer mentor, blah, 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 blah. But what you can say is that you're doing things like you can talk about your communication skills, talking about putting people at their ease, talk about being able to manage distress, talk about being able to orient people to a university where people might, so it's about how do you articulate the experience you've got to make something that looks like you're really employable, basically. Was there another question at the minute? All right, at the minute. Okay, so other experience that you might want to get, you can do some work-related courses. There are lots of courses out there. Feel free to email me if you're considering paying for something like a basic counselling course, because there are lots of online shysters and there's no point. So feel free to email me and I'll give you my personal professional-ish opinion about whether I think it's something that's actually going to be career enhancing for you. And then we can maybe, if you do that, I can then bring it back to the club and we can talk about that a little bit in terms of what things are good. But if you happened to be working for an organisation, so I've had students before in their final year, who are my final year project students, who, for example, worked with children in a kind of youth organisation. It was like it had a mental health bent to it. But they worked about, I think they worked about 14, 15 hours a week. But through that job, they got things like, they were invited to do things like, you know, basic risk management, or some of the mandatory training that you might have to do if you got into an assistant psychologist post. So it's good to be doing things like that. So if you get into a job like that, take advantage of any of the training they give you, because it demonstrates that you can, you know, you've got this under your belt already. The kinds of experience you want is entering the doctorate. Eventually, they want to know that you can work with people in distress, because that's the work of the clinical psychologist. If it's difficult for you to be with people in distress because it distresses you too much, or you take it home, you can't manage it, it's not the profession for you. So you do have to have some resilience and be robust. So I would suggest that if you're thinking about the career, get yourself in a situation where you are working with this client group, just to check out that this is actually the career you want, because it might not be, and that's fine. It's horses for courses, isn't it? If you can experience some kind of clinical supervision, that's really good. Clinical supervision is a whole new beast for most of us. So clinical psychologists supervise each other to death. It's all very reflective. There's a lot of nuance in clinical psychology, and you bring a lot to it as a person. And you have to acknowledge that you bring that stuff into clinical psychology. So you use clinical supervision to discuss your own role, for example, in a tricky therapy situation. So you wouldn't pretend that everything's going well because you don't want to look like you're doing a bad job. You would be discussing some of the things that you are finding tricky, and your supervisor would be helping you with that. So if you can experience supervision, that's also great. And we could even consider having a session in the club where we did some simulated supervision, so you've got a kind of idea about what that might look like. If you can do some extra research over and above what you're doing in your stats courses or in your final year project, that's also quite useful. There are occasionally experiences that are sent to me with people wanting students to come and help them transcribe interviews, for example, or to screen papers for a review. So if people come to me with that question, I usually know some students who are interested in doing that. So feel free to get in touch with me. I can't promise that there'll be anything available, but you know, it's possible. And the other thing that you get from that is that you get to network with staff in the university or with other students. Networking is a massively important thing, and it's not about nepotism. It's not about, you know, people giving people jobs because they're part of a family or they're known to them. It's basic psychology. People you know are more in your mind than people you don't know. So if I've met you and we've had a discussion, I'm more likely to remember you when somebody says, I've got this experience I've got that a student, a third year student or second year student could take up. Do you know anybody? Or if you've got in touch with me personally. I'm not saying you should all get in touch with me. I'm saying use things like LinkedIn. There'll be clinical psychologists and assistant psychologists coming to speak to you in this club. Stay behind, talk to them, email them afterwards. They're interested in helping you with their career, with your career. One of the things about clinical psychology is it is quite difficult to get into, so most of us really want to help other people who are trying to get into it. So there's a lot of very helpful people out there, and it's just about making sure you're available to them and you hear what they have to say. Yeah, and other things like make sure, you know, if you can get some leadership experience and be able to articulate that, think about what model of leadership you might be using. And then writing's always good, you know, enhance your writing and show that you can do that. So I've had a couple of second year students doing blogs for me, describing this club. Is Mia here? No. So I had Mia last year with Steph, and they both helped me write blogs and write sort of advertising material for this club, so I can give them a reference. And not only that, because I've supervised their work, I've got to know them quite well, and I know what their aspirations are, so I'm more likely to be able to give them a relevant reference. Do you see what I mean about the networking and getting to know people and just making sure that your experience is something that you can then translate to a job later? Yeah?
So speaking of experience supervision, it's like, is that really indispensable for becoming a clinical psychologist? Because I heard that like some of the trainees for clinical psychology might need to pay others to get them supervised.
Yeah, so the question was, is clinical supervision necessary to experience to get onto the clinical psychology training? No, it's just another thing that you can talk about. And when I'm talking about supervision, I don't mean about a client, because you won't be seeing clients. Yeah, so it's more about Okay, so when you have your academic advising meetings, you're invited to talk about 3 things at Manchester, aren't you? Invited to talk about, are you okay? So there's a pastoral care element. You're invited to talk about your careers. You're invited to talk about your academic work. That should be what you're getting from your academic advising meetings. So if you think about that and translate that into your mind as being like a supervision, you can reflect on the way that your work's going. You can reflect on the personal skills you're building up as an individual at the University of Manchester, and you can build that. So it's kind of thinking about that relationship as being supervisory rather than going to try and get clinical supervision.
Also, that's not about clinical supervision.
Not necessarily. However, if you were to get a job like the student that went to work with children, it might be that you did get some sort of clinical supervision.
Yes, and that could be paid, and that could be expensive because like money.
No, well, you wouldn't be able to get paid supervision unless you're in training.
Oh yeah.
Yeah, because you wouldn't be seeing clients.
So that would be different.
Yeah, yeah,
Oh,
yeah.
I see.
Okay. Okay. All right so far? I'm thinking this is sort of answering some of the questions, and hopefully as we go along. Yeah, so what kind of roles should you be looking for? Either during your degree or when you first graduate from your degree. So support work is a great one. So I did a lot of support work during my undergraduate degree, but I'd also been a nurse. So I usually have a slide telling you all about myself, but I think I took it away because it went on a bit. So I actually trained as a nurse before I got into clinical psychology, and it's actually been invaluable to me to be credible to my nursing and doctor colleagues that I've got the experience of having worked on the shop floor, so to speak. I've wiped bums, I've given medication, I've given injections, I've been part of very risky, challenging situations. So having that experience, you get that as a support worker, not the injections and the meds, but you get a lot of experience as a support worker that helps you to decide whether you want to work with distressed clients, but also which client group you'd like to work with. So it might be that you go into support work in drug and alcohol and you think that's not for me, but it doesn't mean you wouldn't enjoy working with children or with clients with a learning disability. So it's a good opportunity for you to actually test the waters a little bit about where you'd like to work as well. One-to-one support as a carer. I could add here actually there might be people in the room that have got caring roles already and responsibilities. There is a big push to make sure there are experts by experience in doctoral training and as assistant psychologists. So if you consider yourself to be, for example, a carer, then it could be that could be very helpful to help you achieve your goals, to get your job. What you'll need to do is have a think about what you've got from that and how you've managed the challenges, etc. But again, that's something that I'm really happy to talk to you about. So one-to-one support as a carer. Working in schools is great, probably especially if there's special educational needs, but not necessarily because there is lots of, for example, neurodiversity in mainstream schools. Phone and text helplines, mentoring I've mentioned, research assistant, that can be paid or unpaid. There's obviously a dilemma, I think, for staff at the university about making sure that we're providing paid opportunities for people because we don't want people to be disadvantaged. So there'll be a lot of us, and I couldn't have done volunteer posts when I was at university because I needed the money. So I had to do paid jobs. So we try not to have too many voluntary honorary posts around because what that means is it excludes anybody that needs to actually bring money in. So there is an attempt to kind of address that, but there are still some research experiences that can be voluntary. They tend to be small, so we wouldn't be able to pay anybody for that anyway because they're sort of small. Yeah, and these can be voluntary or paid. Yeah.
Just a quick question, because I'm from the US.
Yes.
Support worker, like I've just never heard that job title before. Is that something I would
Maybe
like, put in
nurse
LinkedIn?
aide or something like that?
Like aide?
Yeah, like
But
an aide.
If I put it on LinkedIn, I would put in support worker.
Yeah, support worker. Yeah, yeah. And there is an exercise at a later club where we'll look at some jobs through, we'll look at some of the search engines and think about what jobs, and then we'll look at the desirable and essential criteria for those jobs, and you'll start mapping your experience against those as well. Okay? Okay? Right. So when should you start? So I saw that one of the questions was, I'm in third year, is it too late to get experience? No, it's not too late, don't worry about that. So that's just the straightforward answer, basically. It might be that you're starting with a different type of experience, but it just depends on what you've done so far. You might already have something that you can then move up a level if you like. Hang on a sec. Don't think that you have to achieve everything at once, and there's something about the career in clinical psychology that makes us all feel a bit desperate and a bit panicky, because we know that it's very competitive to apply for the doctorate. We're like push and push, and I'm saying we because this was me. Push and push and push and try really hard and very quickly to get onto the doctorate. And actually you let a lot of life go by if you do that. So don't make it your life's goal to get onto the doctorate. Make it part of your life, but don't forget to do other things at the same time that are valuable. Otherwise you'll find yourself, your resilience will be really overstretched. I would imagine forging out your degree, your career, is a bit like starting to build a house. So after today you can be planning, you can be thinking, right, what do I need to do this? If this is the career for me, what do I need to do in order to achieve it? Build the foundations, strengthen and support the foundations by getting this work, by getting this voluntary work, getting the experience, reflecting what it is that you've done. Follow a design, so you might be able to have you've got a trajectory in mind, but it might be that that trajectory doesn't quite work out. So don't be disheartened. So try and have a little bit of flexibility in there. If one door closes, another one opens. I could give you hundreds of anecdotal times in my life that that's happened to me, where I haven't got a job that I was heartbroken by, but the next job was actually one that suited me better. So just keep all of those things in mind, but just remember that it's part of a long game, not a very short one. It's a marathon, not a sprint. Take one step at a time. Ask for advice on this planning and building. Don't just do it yourself. Talk to me, talk to any of the clinical psychologists you can talk to. And there'll be people here. There are other members of staff on the undergraduate programme and some on the master's programme. Take any opportunities that pop up. And it might be, so for example, last year, just before I met my final year project students, I received a flyer from somewhere asking for students who might be interested in, what do you call it when somebody's helping out with something? Anyway, looking after stands and ushering people at a psychosis conference. So they got into a psychosis conference for free, doing almost nothing, and meeting loads of people and networking. And a couple of them did sort of stay in touch with people that they'd met. So if an opportunity comes up like that, if you see something where they're asking volunteers for something like that, then just put yourselves forward and do it, because it means you've got to learn a little bit more about something. It's another networking experience, another time when you can decide what it is that you want to do. And don't forget to smell the roses along the way, because, you know, it's not everything. It's easy to say for me, I know, but... Right, I'll just tell you about the doctorate in a sec. Are we all right? The slides will be on Blackboard, by the way. Right, so there's 3 elements to the doctorate in clinical psychology. One of them is the knowledge component. So you need to, you will learn more about psychological theories and interventions, and you will learn about the specific needs and challenges of services, and you'll develop skills for practice. So that's the knowing more stuff. That's the background knowledge, okay? And then there's the clinical practice, which is probably what most people think they want to go into clinical psychology for. So that's the bit where you actually work live with people. So learn how to fulfill the role of a clinical psychologist in practice, practice under supervision, and demonstrate competencies on placement. So for you get, it's changing at the minute because there are lots more places on doctorates, which is good, but that means that there are fewer supervisors in the field, so the way that the placements are organised is slightly different now. But it used to be that every year you would have 2 6-month placements, roughly, with different client groups. So in the first year you would work with children and then in an adult setting. Second year you'd work with learning disabilities and in an older adult setting. And then third year you could choose where it was that you worked. So that's how the courses used to run. So you have these placements, but alongside the placements you have stretches of time at university learning stuff, doing exams, essays, and you also have a research component that runs right the way through your 3 years. The research is you have to complete a novel empirical project and a literature review. In some universities, that's just one big thesis. So when I was at university, mine was something like a 30,000 word thesis that incorporated an empirical study and a literature review of it. At Manchester, it's a separate empirical paper that you write ready for publication for as soon as you graduate, and a literature review, systematic review, and a reflective paper. So there's 3 pieces of work at Manchester. And as part of that research, you have to develop a research idea, you would autonomously apply for ethical approval, you recruit your participants, and you complete the research. And then you have to write it to a publishable standard. And then you have to defend it in a viva. So a viva voce is an oral exam. So you're sat in a room with 2 other people and they ask you questions about the work that you've done. Which sounds terrifying, but it's slightly more pleasurable than you think, because you've done all the work and you want to tell people about it. So you can see that this might be a bit daunting if you're not absolutely sure that clinical psychology is for you, if you don't like research, and well, actually, to be fair, most of the trainees don't like research, but if you really are averse to research, this probably is not the route for you. Are there any questions about this? So it's a 3-year doctorate, and I'm now speaking to first-year trainees about their project, which they'll start as soon as they get the go-ahead, which will be probably November, and then their write-up will be before, where are we now? It'll be before May, because then they have to be fully through all of their work before they can then apply to be a healthcare professional, professions counsel, clinical psychologist, and actually start working. So it's a bit complicated, I appreciate. So it's a 3 years where research is quite heavy.
I was just wondering, at any point, are you able to talk about, I see the University of Manchester's application has a deductive reasoning sort of test before you apply. At any point during the club, are you going over it or anything like that?
Hang on a second. So the question was, Manchester University has a deductive reasoning task as part of their entry, as part of the application process. Am I going to go over that? I'm not personally, but the careers service has, like the careers service will have lots of deductive reasoning tasks that they can guide you to. LinkedIn, get in touch with someone that's got onto the course. One of the people that's really happily saying, I'm so excited to tell you that now first year doctoral trainee, get in touch with them and say, what do you have to do? Most people will reply to you.
Okay.
So ask the people that have been successful what they did, and people will tend to tell you. Hi.
Is the doctorate funded by anything, like by the NHS? Or
Yes,
is
it is. I don't know if that's on one of my slides. I don't know whether to check or whether to just answer your question. Let's see what's here. No, it's not. Right, okay. So here's where it's complicated for international students. The Doctorate in Clinical Psychology in the UK is funded by Health Education England, which is a central funding body, and you are funded, it might be on the slide, never mind, you are funded right the way through training, so not only are your fees paid, but you're actually paid at band 6 level. To put that in, yeah, exactly, that's why everyone wants to do it. To put that into context, if you're a nurse, you can be managing a ward at band 6. Yeah, so you could be in charge of a ward at band 6. A community mental health team, a band 7, you'd be managing a band 7. Nurse students, they graduate onto a band 5, so you train a band above nursing colleagues, and then you graduate to a band above that. And that's important when you get out in the field, because everyone knows how much you earn, because we're all on the same pay scale. So you can be sat there as a brand new clinical psychologist next to a ward manager who's paid exactly the same as you, and they're expecting you to know shit. So that's actually quite difficult, and it's something that you have to negotiate when you're newly into the field. And it was a travesty when they put us all on the same pay scale. You can only do it full time, to my knowledge. Yeah.
Can you do it part-time and do it?
No. you would never have enough hours in the day. You're the only needs anyway with the doctorate, to be fair. So you can't work part-time when you're doing the doctorate because you're paid to work full-time anyway, so you'd be contributing the hours. This is as a UK student. And this is one of the reasons it's really competitive to get on the doctorate in clinical psychology, is that it's paid and it's paid well. There is another doctorate that will allow you to be an applied psychologist in NHS clinical settings, and that's the counselling psychology doctorate, which Manchester also do. And Connor Jeffries, who is a counselling psychology trainee, is co-running the club with me this year. So Connor will be able to tell you all about that. It's slightly less competitive, but still competitive. But you do have to fund yourself. So if you're doing a counselling psychology doctorate, you'd be likely to need to find work. Yeah, does that make sense? And you have semesters. You don't work the whole. You don't have it the whole year. Yeah.
You said it was funded by England. What if you want to study in
I believe it's the same. I believe so. Yeah. And Scotland. I believe it's the same funding. That's a really good question. That makes sense. International students on the Clinical Psychology Club Blackboard folder. There's a folder for international students. I'm afraid there's not a lot of stuff in there because I don't have a lot of information. What I got today from the doctorate was just the link to their page talking about self-funding. It's bad news, I'm afraid, because basically your fees alone have to cover the cost of all your tuition, and that includes your clinical supervision. So you have research supervision, all of your teaching, clinical practice and clinical supervision, and it's currently running at £34,500 a year for self-funders. So it's really, and that's just for the fees. So it's not something that is going to be necessarily open to most people who are international students coming into the UK. Having said that, it might be possible that you could get government funding, for example. You might be able to get a sponsoring body, so that's something to have a look into. I have asked the doctorate if they can ask a couple of their international students if they'll speak to you for the international students. But it may be that they may not want to, so I'm really at their beck and call for that. Any more questions about that at the minute? Okay. Okay, so the reason that you do this, the knowledge component and the clinical component and the research component, if you think about all the processes that go into developing a psychological therapy and then doing the intervention, basically, you need to understand the theory behind people's behaviour. That's what you're doing in your undergraduate degree, but you do it specifically with mental health when you get into your postgraduate studies. You need to be able to apply that theory as part of the psychological intervention, so that's where your clinical practice comes in. So you need to know the theory behind the practice, and then you have to know how all of these interventions are actually developed in the first place and contribute to that evidence base as you go through your career. So you can see why there's these three different aspects to the training. You do get to be called doctor at the end of it, so there's some compensation. Let's see. All right then, I'll put this separately. Okay. So the role of the clinical psychologist will depend very much on what service you're in, what client group you're working with. So some typical client groups you might work with children and families. My background's working with older people. You might work with learning disability. You might work straightforwardly with adults, but there's loads of different services that cover the whole adult population. So for example, there's specific personality disorder services, specific eating disorder services, and so on. You might work solely using CBT. You might work in a neuropsychology department. So there's lots of different ways and areas in which you can work, lots of client groups to choose from. It's a bit like a sweet shop when you start working in clinical psychology because everything is interesting, really. There's different ways of working, so you might work directly with the client, so you might have some assessment with the client, you might have a therapeutic intervention with the client, but we also do indirect work, and that's what I was alluding to before. So you might do some work with staff. So for example, in my work with older people, I spend a lot of time working with teams, and doing what we call a formulation around a client's challenging behaviour. So if we have somebody on our ward who has dementia, and they're challenging in the context of dementia, so in dementia you don't really understand everything that's going on around you, you make the best sense of it you can, and in making sense of it, basically you can act in a very unusual and challenging way. So I'll work with staff groups to help them understand why that person might be challenging in that environment, and then help the staff group. So I help them understand the psychology that I understand, and then they help me understand their environment, and we discuss what we can then do about helping somebody work with a challenging behaviour. So anyone that's still here in third year and takes my clinical psychology unit, that's what I talk about. We also do consultations, so it might be that, so for an example, another time I was working in a hospital where there was some staffing problems on the ward. The team had somehow managed to divide itself into two. There was difficulties about people being on shift together, there was difficulties about taking instruction, and then there was also difficulty about taking initiative. So we worked together, myself and the manager and her deputy, to map out what might be going on with the staff and how staff might move in their behaviour to work better with one another. So there's things like that we do. We supervise other people in psychological matters, so it might be that a nurse colleague might bring a problematic client to you in a team. They can't understand why they're not moving forward with the person. The person seems to not want to get better, and you help that person understand some of the mechanisms behind what they might be seeing in terms of their presentation and how they might move beyond that. And quite often with these things, once people understand the psychology behind it, it opens up a lot of doors anyway, and they don't need psychological intervention from a clinical psychologist. And then the service development evaluation. Evaluation is a big skill that we've got that comes from our research background. So we know how to systematically evaluate a service, we know how to compare it with another service, we know how to audit, we know how to do research around the service. So it's a big skill of ours that most of our colleagues don't have. So none of the colleagues in a multidisciplinary team will be actually trained in this. Doctors are trained in audit, but not really in anything like evaluation. Anything else about the role that I can, yeah?
Just a little confused about the team consultation, because that sounds like the role of like an HR body. Like, is that truly the job of the clinical psychologist?
Okay, so the question is the team consultation should that be part of HR's work? HR are not, they're not trained in psychological understanding. So you, as a psychologist, you'll be using a psychological model of understanding human behaviour to understand why this group were not interacting well with each other and behaving in this particular way. HR don't have that. Some organisational occupational psychology might have that, but they tend to be a little bit more around judging people's ability to do a post rather than, so psychometric testing and so on. Any other question at the minute? Oh yeah, so other roles in mental health. So there are lots. So we talked about Health Education England before as being this funding body for the doctorate in clinical psychology. They are also funding lots and lots of different posts now. So one of the only good things to come out of COVID is that the UK government realised that we have a mental health problem in the UK, and it hasn't got any better, and we need to deal with it. The cynic in me says that's because there's too many man-hours lost from work, but you know. So the Health Education England is also financing a lot of other training posts, and you'll hear from some people who have taken up those training posts during the course of the club. So you'll hear, hopefully, I haven't asked it yet, you will hear from a psychological wellbeing practitioner, you will hear from mental health wellbeing practitioners. They're the newest probably post. They're individuals who work inside a community mental health team doing some low-level CBT-based psychological work. They may not be supervised by a clinical psychologist, they may be supervised by somebody else, and they do things like educate people around the psychology of their condition, for example, or they might do some lower level psychological intervention. Some of these posts being in their infancy and not well developed. So that can mean that there are some constraints in the way that you experience the post. So it may be that you find your team members don't necessarily know exactly what you're supposed to do, and neither do you. So there's that sort of slight thing going on where you have to negotiate your role a bit. Education, mental health practitioner and children's wellbeing practitioner, these are new posts, and they actually are the taught element of that is at Manchester University. I think the taught element of the psychological wellbeing practitioner, I think, is at Lancaster. Their new posts in children's services, one is based in schools and one is based in community teams. And again, there's a video which I'll make live at some point from the Director of Studies for this course, who will tell you more about what the course actually involves and who these people are that take these courses up. And then there's counselling psychology that Connor's going to come and talk to you about. But there are others as well. There are trainee associate psychologists, TAPs. There are associate assistant psychologists or associate psychological practitioners, who are AFs. There's also a CAP, which I can't remember what the acronym is, but there are lots of them coming up. So when you do your NHS searches, when you're thinking, I'm going to think about my career now, I'm going to start looking at just what's out there and see what experience I need to get, there are quite a lot of keywords to type in there, and practitioner is definitely one of them. So you might get lots of mishits, but that's where you'll get some of these APs, CAPs, TAPs, PWPs, MHWPs and so on. So you see a lot of them have got practitioner in the title, and they don't all have mental health in the title. They don't all have psychology in the title. Okay, so I'm going to go back to the questions now, and hopefully quite a few of these will have been answered already, but if not, then I can go over them. So we've talked about qualifications, we've talked about steps. Standing out in the application is, I would say, having all of the above, basically. Yeah.
Sorry, it's like you did a picture about counselling psychology.
Counselling psychology, we're going to have a counselling psychologist come in and speak to us. Yeah. So it's not my specialty. Where to find experience for clinical psychology? I would say that putting yourself in the place where you might pick up the experience is the way to do that. So there's been a number of students that I've known who've maybe started out as support workers and have moved into a position where they know psychology is part of the environment, so it might be on a ward, for example. And what they've done is they've just hung behind on a shift and asked the psychologist if it's okay if they then watch what it is that they do in a group session or something like that. Psychologist gets to know them, they get to know more about what happens psychologically on that ward. The next thing you know, there's an assistant psychologist post comes up, and they're in a prime position to take it. So it's finding the experience where you find the people, and then finding those people who know the people. So it is that big networking, putting yourself out there in placements where you can actually meet people. So that might be another reason why your second year might be a good, your second year placement might be a good one. Work experience. We will be talking as the club goes forward. I will be talking more about work experience. And one of the sessions that we've got, I've got it recorded, but might ask you to come and do it live again, is from a trainee clinical psychologist who talks me through in this sort of interview all of the jobs she's done before she got onto the doctorate. And it's quite useful just to hear from a few different trainees about the things they've done, because people have got such different career paths. It can feel a bit daunting though as well, because a lot of them have done an awful lot. So it does feel a bit like, oh God, I've got so much I have to do. You don't have to do all of that, but it's interesting to hear.
Will you talk about the application process in the club as well?
When I talk about the application process in the club, I wasn't planning to, because I'm not part of it, and I would only be able to speak from the Manchester point of view. The best thing to do is to go onto the, if you go onto the Blackboard folder, it will guide you to the sort of handbook for application. And there's also a kind, I think in there as well, there's a kind of alternative guide, you know, like you've got for undergrad degrees. There's an alternative guide for your postgrad study as well. So that would be what I would suggest. But when you come to the club where the trainee is talking about all her experience, hang behind and ask her about it. Just ask people. They'll tell you. They'll tell you what they can tell you. There's going to be some governance, because they're not going to tell you exactly what they were asked to interview, for example. But, done that. Qualifications done, step by step. We will talk more about that. Yes. Pathways to becoming internet. Yes, a bit. Yes. Yes. There are no apprenticeships for clinical psychology, unfortunately. No. I think in some ways being an assistant psychologist is a little bit like that, but it doesn't get you a qualification at the end of it, because it does allow you to do a lot of the things that a clinical psychologist would do under heavy supervision. Okay, what do I need on top of clinical psychology? Right, so clinical neuropsychology is a slightly other thing. I got part through that path and then I just thought, I can't be bothered with that. So you have to be a clinical psychologist first, and then you have to take an extra qualification, a postgraduate diploma, and you have to then, to call yourself a clinical neuropsychologist, you then have to do the qualification in clinical neuropsychology, which is basically casework, which you have to write up as case studies, and then you're vivaed on your casework. The problem with that is not only is it onerous, so you're back into academia, like I did the PG dip, and it was fascinating and brilliant, but God, sitting exams again, like, at my age, it was just too much. So the problem with it is that you might find yourself in a service where you don't see a big spread of cases, neuropsychology cases, and to get that QCIN, I think it's called, to get that qualification, you have to demonstrate your ability to manage different cases. So you have to have case studies in all different areas. So when I was working in older adults, it was almost impossible to get cases across younger people. So in brain injury, for example, it was difficult to get cases, or Parkinson's or something like that. So yeah, so it's extra work. It can be worth it because independent work as a clinical neuropsychologist gets you loads of money. So, because I was able to do that with my PG dip, so that saw me through a couple of hard times. I think we've talked about that. Yes, clinical psychologists work very closely with nurses and doctors in NHS hospitals. It tends to be in mental health, but there are more and more clinical psychologists working in health. So there are clinical psychologists in pain management, so I worked in neuro rehab for a while. There are clinical psychologists in, let me think of the things, cardiology, stroke, long COVID. So there's lots of physical health settings where clinical psychologists work as well. So we work very closely with our colleagues. You can do research after becoming a clinical psychologist, and most of the tutors and the staff who are on the doctorate of clinical psychology, who work on that doctorate, did their doctorate in clinical psychology and then had a research career. And that's what they're doing. So they do their research and they work on the doctorate in clinical psychology. So I'm a bit of an outlier moving into undergraduate teaching rather than research at a university. So generally, if you're a clinical psychologist, you come back into the university, it's because you're researching and you're working on the doctorate. You can also do research while you're working as a practitioner, so you don't have to be in a university. It's a little bit harder. It's easier to do. So both of the trainees that I'm supervising on their empirical papers, they have got co-supervised people supervising with me who are field clinicians. So they're doing research through the trainee, and they'll get a name on their paper through the trainee. So the trainee's doing what they want them to do. So they're practicing their research in a slightly different way. Life of a clinical psychologist. We can do a day in the life sometime, but it's very different for different posts. So we'll get each of the people perhaps that come in to talk to you who are practicing clinical psychologists, perhaps they could tell you what their life's like. Sort of CP, clothing qualifications, day in the life, schedule. Yeah. Okay. Right. So I can feel that everyone's tired because I can feel a bit of moving. So what I'm going to do is I'm going to check on Mentimeter that I've answered all your questions. I'm going to put any other answers that I need to on the Blackboard page with the PowerPoint from this. So I'm going to let you go, but if you wouldn't mind just carrying on with Mentimeter and going on to some evaluation of what you've experienced today. Honesty's fine.